This is the lateral position of the upper airway. We've got a 72-inch SID with a 10 by 12 collimation, and we have used our rolling shield for radiation protection. So the patient is standing upright. They can be seated or standing in a lateral position. You can do a right or left lateral. We've chosen to do a left lateral position. And you can also do this recumbent on the tabletop if necessary. So position the patient so that the center of the upper airway with the central ray to the larynx and the trachea in the anterior portion of the cervical and thoracic vertebra. You want to make sure the shoulders are rotated posteriorly with the arms down and the hands behind the back. Make sure their chin is raised slightly and have the patient look directly straight ahead. You want to make sure to adjust the height of the IR at the level of the EAM with the central ray perpendicular to be centered at the level of C6 or 7 and midway between the laryngeal prominence of the thyroid cartilage and the jugular notch. We'll instruct the patient to take a deep breath in and hold their breath for the exposure, and then go ahead and breathe. So the optimal exposure is going to include the soft tissue of the air-filled larynx and the upper trachea, as well as the cervical vertebra, all appearing exposed adequately. The next position will be the AP upper airway. So we'll have the patient turn with their back against the image receptor. And we'll have you just step this direction, just, oops, too far, right here, and bring your chin up. There you go. So this is our AP upper airway. We have moved our SID to 40 inches. And then we're going to bring our collimation in. Again, we've got our patient shielded. Central ray is going to be centered so that the acanthomeatal line is perpendicular to the IR. The central ray is going to be adjusted at the level of C7, T1, and then we'll tube film a line. Place our marker, and again, we'll have you slide over just a little bit. Take a deep breath in, and you can breathe.